Hi, I'm Dr. Joe Albano with my buddy Sammy Spine here. Today we're going to answer about the question, back pain treatment. What could you do for that? So first, before we even get to treatment, we need to talk about, well, what causes back pain? And there are so many reasons for back pain. And a lot of people will get x-rays when you come to the doctor and an MRI, and we kind of glom onto the disc and see if it's pushing on the nerve roots, which is important and one important possible etiology for the back pain. But there's so many other ones that are even more common too. So looking at Sammy here is showing us, so there's some discs. Right here, actually, let's look on this side. A disc can bulge and push on this nerve root right here. We can see that. Disc pushing on the nerve root. And the spinal cord, which is the yellow stuff in here, that can be compressed. There can be some spinal stenosis in there. MRI is really good for showing that up. And then the standard treatment for that, once you get to the doctor, is a shot, like an epidural steroid, that goes into this space right here around the spinal cord. So when women have babies, they'll get an epidural with local anesthetic, not a steroid, and it numbs up the lower extremities. So the epidural steroid puts steroid in there, and that can help decrease inflammation. So that's commonly what's done, and that will be done a few times. And then also, if that doesn't work, then they'll go to radiofrequency ablation, where if you look at right over here, there are nerve roots. Can't see it on here, of course, but there are nerves, sorry, not nerve roots, nerves that are going right here on this lamina, and go in there with basically this radiofrequency tool, and it kills the nerve roots, and it can decrease pain for a period of time, but that comes at a cost. And what's the cost of that? The muscles around the area are weaker, and every time you do that, they get more weak, or weaker and weaker and weaker. Going back to the steroid, what's bad with that? So steroids, every time you do that, it doesn't fix the problem. It does decrease some inflammation in the area, but steroids have a negative effect wherever you put them. The more you do, the worse it is over time. So it's not something you want to keep doing. So steroids, radiofrequency ablation, then you get up to surgery is the next step that typically doctors will say, oh yeah, let's go do surgery on that. And that comes in a lot of different forms. It could be, going back to Sammy over here, so this bulging disc could go in there and just take a piece out of that. There's this biter-like tool that goes in there and takes that out. But the problem with that is, what's the disc really like? And I think of it like a jelly donut. You take a bite out of the jelly donut, what happens? All the jelly squirts on your shirt down here like that. Same thing over here. You're now having the softer stuff on the inside can come out, and it just destabilizes the disc. That is necessary, I think, in one main indication. If you have a big disc pushing on the nerve root and you have motor loss or motor weakness that's significant and continuing, that's the only thing that's going to work. But that's not a lot of the patients that I see, so don't necessarily need to do that. But if you get that surgery, destabilizes the disc, next surgery you're talking about is a fusion. Oh yeah, well, let's just fuse these levels over here. What happens then when you fuse that years down the road, this disc disc space that is fused doesn't move, so the one above and below it just moves more, and then you wind up getting a fusion there. And it's just not the best way to treat back pain, because you're not looking at these other causes of back pain. Other causes of back pain, you can have arthritis in there. You can have arthritis in these facet joints right over here, or zygapophyseal joints. The disc itself can be degenerative, and you can have tears in that. That's certainly a problem, and you can put PRP and stem cell kind of things into that disc as well, and that can heal it. There's good studies looking at that nowadays, but I still think you don't even need to do that most of the time, because out over here, we can't see it on this model here, but there's lots of ligaments going like this, over here in these sacroiliac joints, further ones down here, ones over here. there's ligaments in a lot of different places, and those can get damaged. Like if you sprain your ankle, same kind of thing. Commonly, people who have back pain will have been in a car accident, but of course you don't have to have been in a car accident to have back pain. But think about it, what happens if you're in a car, you get rear-ended, your head and your back kind of go like this, and then you go forward like that. So you can stretch these ligaments or sprain them. And there's a technique that's been around since the 1950s, prolotherapy. And that principle is you put something, they used dextrose back then, we still do, but you put something in there to help to heal the ligaments and cause an inflammatory healing reaction, and just that can help. But the muscles can be damaged, and here there's small muscles going up and down there, and all these strap muscles on the side of the spine, and just those can be damaged. You can have a strain of the muscle in there or a tear, and then there's fascia overlying the muscle. So if my hand is a fascia over the muscle, that can be stuck down. And if you go to physical therapy, they try and free that up so it'll move with massage techniques, and that sometimes work. If that doesn't work, we can do things with fluid, PRP, bone marrow, put it into that area to help free that up. And you can really tell the difference, like when we do procedures on people, if they've had a problem in the lower spine and that's really stuck down, you free that up, and just that can help them. There's also a study that it came out in 2019. This got me thinking of a different way to do it. So there's the epidural steroids, and what about if you put platelets in there? So this study came out, and all that it did was did epidural, not steroids, but it did platelets in there, did 2 of them, spaced them 6 to 8 weeks apart. It was a study of 250 people, and what it showed was that, and it followed them out for 2 years, but at a year, what it showed was that 85% of these people had significantly decreased pain, and the average went from a scale of 9 out of 10, a VAS, visual analog score of pain, scale of pain. A 10 is the worst pain you've ever had in your life. These people were at a 9, and it went down to an average of 3 afterwards, or even 2, and it persisted. So that's a really good study. After I read that study, I'm like, we need to start doing that. So our approach to back pain is first evaluate you, see what the causes are. So we do a good history, physical examination. If we need to, we can use ultrasound. We definitely get x-rays and MRI to look at these things, and maybe an EMG nerve conduction study. That study is kind of interesting because what that does is it looks at the function of the nerves. So if you have this case right over here on Sammy that's just pushing on this nerve root, the EMG nerve conduction will tell you how that nerve is functioning. The MRI is going to look at the anatomy of it, and you can't always use that to guide exact treatment, because people will have a lot of different things and they may not be symptomatic. So that's the art of medicine right there, figuring out what's symptomatic, what's the etiology of the back pain. And we didn't even talk about conservative things, but that's for another video. So hopefully this was helpful, and please check us out on our website. Give us a call if you have any more questions, and we hope you can live better without surgery.